Yeah.
This is the more detailed of the other. There's another one just like this. It's a plaque model that's in there. You have to kind of learn both of them because they're really not the same. They're not totally identical. But if we start off, they can ask you any of these. They can start with, you'll see here, this one actually has a prepuce still here, which means that it's uncircumcised on this particular one. If you're looking at the testicle structure, here's the epididymis, and this is the actual scrotal sac with the tunica vaginalis, and then right over here is the tunica albuginea. This is the spermatic cord. This is the vas deferens. It comes all the way around, goes around the urethra just like this, and connects with the seminal vesicle over here. Here's a prostate. Here's a urinary bladder. Here's a suspensatory ligament, and so on. So once you take that away, though, you get to see all the good stuff. So inside the bladder, they can use it for urinary and or reproductive. You have the rugae. You actually have the trigone, which you can see partially here. This is the membranous urethra. This is the prostatic urethra, and then the rest of it is spongy urethra. This is the prostate. There's the ejaculatory duct. This is Cowper's gland, or the bulbourethral gland. So you actually have three glands that secrete semen. One is the seminal vesicle, the other one is the prostate, and the other one is the bulbourethral gland. This is the cavernosum. This is the spongiosum. This is actually erectile tissue, the gland's penis, and then this is the cavernosum, which is also erectile tissue. You can actually see on this particular model something called the rete testes, which is located right there. You can also see the dartus muscle. You can't see the cremaster muscle on this one, but you can see the dartus muscle, which is these red dots here. Up in here on a male, you can get an idea of what, like here is the urethra coming down, and here is the vas deferens going around. So they sometimes will like to ask about those. Beyond that, well, they'll ask you about the muscle inside the bladder. That's going to be the detrusor muscle. And that's about it for the male. They can also ask you digestive. This would be the internal anal sphincter. Excuse me, external anal sphincter, internal anal sphincter. That's about it, if they choose to. Yeah, pull this guy. All right. On the female, there's actually more detail on this.
Should I put it down?
Yes.
Okay.
Oh, we pay attention. Don't be distracted. On the female, you have...
I got that on video. Like 4 other people.
They're going to put you on YouTube. So what we have here is the same situation, but the plumbing is a little different, but everything is homologous as far as the structure, so we'll kind of go through this. But first you have the uterus, which is the most superficial, the most superior, and then you have the bladder. Here's a broad ligament. Here's a broad ligament. This is suspensatory ligaments for both of those structures. But if you look over here, you can see here is the endometrium, the myometrium. Excuse me. This is the perimetrium, the myometrium, and the endometrium here, which leads to what's called the cervical os, or the external cervical os, to the cervix, the vaginal canal, to the vestibule, or the opening of the vaginal. They actually have left the remnant of the hymen here, which is kind of like a prepuce or a uncircumcised male. Then they have the labora major and minor, and let's see. This structure right here is the clitoris structure, which actually is homologous with the glans penis. And when you get up in here, it gets a little different. You have, again, through here, you have where is it? Here it is. The urethra, you can see coming down through here, going both sides of the actual uterus and getting into the urinary bladder. But then you also have these ligaments. This is a different ligament. This is a broad ligament. This is actually a suspensatory ligament for the bladder. But over here, you actually have, there's these two cords. One cord is the uterine tube, or the fallopian tube. And the cord that's even closer down this way is the actual ovarian ligament that attaches to this, kind of this yellow area here, which is the ovary. I don't know if you can see it or not. And then this red area here is actually the velvety fingers called the fimbria that actually catches the expulsion of the oocyte or the ovum and brings it up into the ampulla of the fallopian tube. So they can ask you any one of those structures, and that's about it. The labia majora and minora are the same things as the different layers in the scrotum. The clitoris, like I said, is just like the glans penis. There are glands Bartholin's glands within the vaginal tract, which are similar to the glands that the male has as well. We'll talk about this when we actually get into the lecture portion. But that's about it. Now, these are similar but not exact to the other two that are represented by two other plaques. So make sure you look at both of those. But that's about it. All right? Did you notice any new histology slides?
Sorry.
Help?
No, I'm good.